go via G-tube. So this is like the benefit of having that unresponsive diabetic patient who you would like to feed by mouth, but you can't. I'm going to pass around the Mickey button because this is the most common that we have. This is the MIC, this is the key. It's a very low profile button, the same one Gavin was wearing in that picture. And this is just a simple tube that's inserted into a surgically created stoma directly into the stomach. You access it by just lining up your black lines and twisting, and now you have access. If they don't have the attachment with them, you can pop it open with a 14 gauge catheter without the needle. Don't stick the needle in there, but it's just a little window. We don't ever want to force with a strong, are you yawning?
Yeah.
You don't ever want to.
Wow.
I'll just step out a little bit.
We don't want to force it because that's going to cause cramping. Typically it should be able to go for gravity, but if you need to get this a little gentle, you can. What we can also do with the Mickey button is we can vent. So we have kids who develop gastric distension, which a lot of our kids do because they all have slow motility. A lot of them have a fundoplication too, or they close off that top sphincter. They become really gas distended, uncomfortable, crampy, crabby, screaming. They fight against their vent, and this is just a way to relieve that distension. And that's CJ with his nurse showing how to vent his belly. He was showing community how he belly farts, and they thought it was great. So I will, one thing. This port right here says BAL. That's to inflate the balloon. It's with sterile water typically. That won't introduce anything into the belly. Me as a medical provider, I see something to stick a lure lock on, I immediately think that that's where drugs go. So you'll also notice there's a drug port and like an open port. They both go the same place. The only cool thing about that drug port is that we did find that we can screw a drip set on it, which is kind of cool for our kids who get D10 drips. Something else I want you guys to know about is stoma, and Dr. Siegler talked about doing a skills lab, so I can get you fun to do this. But the next one is talk about reinserting them. When they pop them out, which they do at home, a lot of times they'll do it because they are getting their feeds and they wrap their foot around their feet and they kick and they pop it out with the balloon inflated. Not a medical emergency. You might have gastric contents spilling. It might be disgusting, might be bleeding. They're not going to die from it. What we do want is that stoma to be protected because it'll close itself relatively fast. So if you can clean that up, not sterile, just soap and water, rinse it off, lube it up and stick it back in, which parents are trained to do. But again, if that caregiver isn't there, if they're in school, that's the best thing for them because we don't want that stoma to start closing. Real quick, I want to introduce you to the GJ. Some of our kids have GJs because they can no longer be fed in the belly. So we will go ahead and deliver their feeds into the jejunum on a slow drip. Nothing gets bolused into the jejunum. That is only for feeds on a pump. Typically don't do meds into the jejunum either. If this displaces, they have to go back to get it put back in. But I also wanted to show you guys it has two ports. You have one that says jejunum, one that says gastric. You guys just won't use the jejunum one for anything. Are we at 11, or do you want me to go?
Yeah. Oh, you want to go over 20 minutes?
Okay. I'll do the one. Oh, I just took it away. I want to do yours first. Okay. So this one, you get a 911 call for pediatric behavioral at the elementary school. You have a 7-year-old female in the nurse's office. She's irritable, she's crying, she's being super bratty and unreasonable. The school nurse said she pushed someone down and then was throwing items in the classroom. So grandma isn't able to get to school, but she wants her transported to evaluation and she wants her at Cardinal Glennon. And you're like, really? Because she's being bad? After asking grandma why she wants her evaluated, she tells you that, you just don't get any firm answers, but you agree to transport because you're just tired and you're ready to just do it. You notice she just kind of walks real slow to the ambulance, and then she vomits when she's on the stretcher. These are the vitals that you have, and since you're really nice that day, you're helping wipe off the puke from her chest. You notice she has a port, and then you notice that she has a STARS tag on her backpack, but it's kind of worn. What are you guys gonna do? You didn't get a page that she's a STARS patient.
Check her blood sugar.
Yeah. That's a good one, right? So you check her blood sugar, and we'll say it is, close these down. Should be able to switch my screen, but you, let's say your blood sugar is 86. And I kind of want that star going, right? So this is actually a kid. This is one of the newest stars. One of the newest ones I put in. I think there's been some since. But who's in your program. And I flagged her at school, but I don't know that you'd be able to get her plan at school. So you can do one of two things. So you can hopefully, eventually, you'll have access to the database that's for this. So once you're in this, even if you don't have her number, this little girl's name is Willow, and we're going to look at her actual plan. So once you start typing her name, it'll auto-populate down to her plan. You can call Cardinal Glennon and tell her that she's one of our STARS patients, and they can look it up for you. Problem with that is they can't physically send it to you, so they're going to be reading this stuff word for word. Or you could ask Central County to find her, and they can actually duplicate it from her house over to you guys right now. So Willow is 7. I chose that scenario because the last time she had a crisis, she actually pushed a kid down on the playground and was being a brat. So because one of the first signs when she starts going into it is behavioral issues. We usually don't talk about social home situations with STARS unless it's pertinent, and I believe it's pertinent in this case because her great-grandmother is her custodian. She's great, she's a wonderful historian, but she's elderly and she does the best she can, and that would be a scenario I think would be realistic of her not being able to get to school or really, use her cell phone properly to tell you everything. So she has a very serious metabolic disease where she is unable to break down certain proteins properly, and she can get extremely acidotic. And like Joel said, check her blood sugar, which you definitely want to, but at the same time, even if she's not hypoglycemic, you still want to initiate this D10 drip at 1.5 maintenance. As soon as she's ill or vomiting even once, this needs to be initiated right away. And the thing that I want you guys to know about STARS, if you're not familiar, is that these plans don't go live for you until your medical director hits approve. So in this system, viewers cannot view these until the medical director hits a button on the top that says approve, which means that he or she has seen these orders, thinks it's appropriate, and so you don't have to call for that. You can know it's a standing order for you at this time. She does have a port, which is something I was discussing with Dr. Stiegler before this. You guys don't carry Huber needles. You should be able to get a peripheral line on her. But if not, I can see about if she has one with her. If she does not follow her metabolic, and she lives on Criterion, by the way, guys. If she does not follow her diet to a T, and she happens to eat foods that have the proteins that she is unable to break down because she's missing these enzymes, she can become extremely ill, and that can actually roll into seizures and coma and permanent brain damage. So any type of ataxic gait, which could be why she was walking slow to the ambulance there, behavioral type signs, seizures, any of that are going to be signs of impending acidosis, or that she's already starting to get acidosis, and she could lead to life-threatening encephalopathy. All of our kids also in the database have specialty forms, so if for some reason you'd have to land somewhere other than Glennon, this is an explanation for that attending that receives her so they know what labs to draw and what to push. This is another reason why STARS took off so hard in the hospital. In these clinics, you can see that they want that IV started right away with D10 half NS with 20 milliliter equivalents of potassium chloride. That used to say EMS. They had that letter written that said EMS, please start this. And I laughed at them. I'm like, we don't carry that in the ER, guys. They're like, oh, really? No, it's not happening. So Willow actually came to me as a direct referral from her geneticist, who was very busy and way above me and hardly ever communicates with me at all, but he felt she was at high risk because of her occasional non-compliance with her feeds. She likes to be a Glennon, which why not? It's fun. So sometimes behaviorally she'll refuse those just to try to get to us too. Any questions about her in general? Let's do, see, we'll go back to the, has everyone here run a STARS call? Anyone not run a STARS call?
Do we have?
Hmm?
Yeah. All, right now, yours is only through Central County.
Yes.
Not Christian's fault.
Yeah, so right now, you will, on the pre-plans,
Bring it in the back of the truck to be on the laptop, or on the.
so when you, sorry, I'm like losing my presentation. So when you guys, you said that you have, so those of you who haven't, when you get a STARS call, you will, it will come up to you as a pre-plan that will light up with call notes on it, and you tap that, and it should pull up your STARS plan, the old STARS plan.
Old as in hospital information?
No, sorry, the old, not the database. The, in fact, I can show you hers. The old model. I'm gonna be slow. I'll show you the old one as soon as that pulls up. What it looked, just the old outline looks a little bit different than that one. So when you have several event kids in here, she's the only metabolic one we have right now. Lots of neuro ones as well. I want to go over one more scenario with you before we quit. And then we will one more. I'll show you one more kid that just moved into your district, and then we'll let you guys practice with trachs. So. This is Soraya. She just moved into your district off of Sinks. She came from Florissant, where she was a trauma arrest from a motor vehicle accident. They got her back, and now she is a quad. But she is one that cannot tolerate even like very brief periods off the ventilator. So she needs to be on her vent constantly. She's one who also, you're going to want to know like her cuff inflation. She gets inflated for sleep, and then during the day is not inflated, but you'll have your cuff inflation on there in case she's having problems, respiratory distress. Inflating her cuff may help her. You'll have vent settings and everything else. On a lot of our kids too, I try to do current photos so you can get a better gauge of their baseline and see just how bright they are. You'll have that on plenty of them. So I'm not going to waste time getting my presentation back up because I exited it out. I know you guys are tired. as far as take homes on these, how do we improve? Having plans like STARS, obviously. And it doesn't have to be STARS, it has to be those comprehensive plans. And then, like we like to say, I steal a quote from Tim Parechko. He's got a great podcast on technology dependence that I love. It's know the player, know the game, and that is a huge take home with these kids. If you know what their game is, it's a lot easier to treat them in general. And then programs like moving them into, your community care medicine programs, etc. I think is going to be big for them in the future. We're looking at that. Potentially getting some of our kids into your CHAPS programs as well. So, any questions about any of the STARS kids or any that you've run or any that you're interested in looking at while I'm here? Anyone want to come and go through trach troubleshooting with me? Okay. Those of you who want to go through trachs, let's do that, and then I can finish. We can be done for the rest of you. So, thank you guys.
Thank you.
Yeah, anyone who hasn't had trachs, come up.